Hi students, I am Dr. Badrinath. Anti-ulcer drug agents or anti-ulcer drugs is the today's topic in this video. This is the most common in nowadays, most general disease, most common disease. And also this is the most common in all the examinations, both regular examinations as well as the competitive examination. Ulcers, everybody knows nowadays. Even high schools in non-pharmacy students also, they are able to tell what is the meaning of ulcers. Okay, anti-ulcer agents is the today's topic. Mainly, spicy food is the main responsible for this. Spicy food. Now we will see what is this cycle. Yeah, there is very interesting cycle. Most of the students do not know this cycle. Spicy food mainly responsible for the excess acid secretion in the stomach. Excess acid secretion that leads to acidity. This acidity, it leads to ulcer. See here, this is the ulcer. This ulcer will not remain constant. This ulcer, it produces again the excess acid secretion. See, this cycle never ends. Never ends. It is a triangle love story. Excess acid secretion loves the acidity, stomach burn. This acidity loves the ulcer. Ulcer again loves the excess acid secretion. This not remain. It produces the excess acid secretion. So again it produces ulcer. One ulcer leads to 100 ulcers. It leads to like that. Right? This cycle never ends. Yeah, this is my mobile app. You can be download from the Google Play Store. Pharmatrix for exams. This is my mobile app. After downloading, open the app, go to the store option here. See the cursor, see my pointer here at the bottom. Store option. So I am offering all the courses here. Then my notes, whatever I am presenting the notes, it is available here. You can be open it. You can be. So this is 99% free for all the students. Okay. Just nominal cost only. I am collecting 100 rupees or 250 rupees like that only. Right? Okay. Now itself you download it and you keep watching all my videos in the play. This is my YouTube channel. Here you can see my playlists, channel playlists. See the pointer here. I have uploaded all the videos are available. Subject wise videos are available. See, if you open this pharmacology, again all the subjects will come like that. Number of videos are there. You just watch it. All the video content is available in the app, mobile app. We are moving as per the syllabus of the pharmacy. Here you can see the first chapter is already completed and it was readily available. Everything is sweet and short. What is necessary things only I will tell. Unnecessary things I will not tell. Okay. Anti-ulcer agent. This is our topic today. Yeah. What is the meaning of the ulcer? See, this is the stomach. We know. His stomach is made up of like this, all the layers. So this is a cross cutting of the stomach. This is the inner layer called as a mucosa. See here, mucosa. This is a inner layer. Okay, and what you saw here, that is a white color. Full white color is called as a serosa. Serosal side, mucosal side. And now what happened between this submucosa? So why you are calling as a submucosa? It is present below the mucosa. That's what. And this is muscle layers. Muscle layer. See, M submucosa, again M, and S serosa. Like that it comes. Okay. Now what happened? What is here? Mucosal layer is continuous throughout the stomach in the inside. Mucosal layer. Now here you can see the breach. B-R-E-A-C-H. Breach, not beach. Sea beach, not beach. Breach. Breach in the continuity of the mucosa. This is not continuous. Somewhat breaches will come. That extends into the submucosa. This is not confined, not bounded to the mucosa. It enters into the submucosa, muscle layers, or deeper layer like a serosa, up to serosa. It forms a holes up to serosa means it forms a holes. Okay, the acid will leaked into the body from the stomach. Very dangerous situation. The patient will die immediately if is there such a things. Okay, This occurs, this ulcers will occur in the GIT, gastrointestinal tract. Yeah, very important slide. Okay, the entire concept it follows you if you know this concept, because all these are the aggressive factor. Acid, pepsin, bile juice, H. pylori, Helicobacter pylori increases the acidity, aggressive increases. NSAIDs, non-steroidal painkillers, other drugs, any other drugs also. Smoking, alcohol, stress, free radicals, oily food, spicy food, irregular dietary habit, hereditary factor, all these causes the acidity, ulcers. Okay, and these are the protective, like a mucus. Mucus is very good. Mucus, PGE2, PGE, prostaglandin series E, like IL, interleukins, like that. Mucosal blood flow, all are friendly to the stomach, like a bicarbonates, SDO, catalyze EDRF. I will tell you later. So ulcers are produced due to the overexposure to the acid secretion. Acid, morning acid release, evening acid release, night also acid release. Produced due to the imbalance between. That's why here balance is there. There should be a balance. These factors are there. These factors are also there in the body, but there must be a balance. If these aggressive factors are dominant, ulcers results. Very, 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 very important slide. And the types of ulcers, three types. This is esophagus, we know very well. So here there is a chance of production of the esophageal ulcers inside. And this is a stomach. So gastric ulcers forms here. Gastric ulcer. Here this is duodenum. Duodenum. So duodenal ulcers will form here. Like that. Three: esophagus, gastric ulcers, duodenal ulcer. All are called as a peptic ulcers. That is a commonly we are calling it. This is very, very important slides. So here, this is the stomach cells, parietal cells. It produces the acid. These are the parietal, which cells produces the acid? Parietal cells. Okay, here you can see. It releases the acids here. Okay, vagus nerve, mainly number of times it was appeared, vagus nerve. It releases the acetylcholine, that is a parasympathetic system. It increases the acidity production. Whereas a sympathetic system stops the production of all GIT juices. I have already told in my sympathetic video. ECL cell. Here also you can see what is this ECL cell. That and all here you can see. Can we get it? Okay. And D cells here, delta cells or D cells are somatostatin. This negative. It is having a negative action on the G cell. G cell is having a positive action on the acidity. It releases the acidity. Here, histamine, ECL cell produces a histamine. Histamine is having a positive action. D cell is having a somatostatin having a negative effect on the ECL. What is a D cell means? Here I have told it is somatostatin producing cells are the D cells. Okay. G cell. You can see the G cell. Gastrin. Here it is. G cell. Gastrin cell. It is a type of cell in the stomach and duodenum, stomach and duodenum that secretes the gastrin. See here, G cell, gastrin, GG matching. Okay, this G cell is having a positive action on the acidity. Okay, producing a thing. This is a blood vessel. Okay, very important and you have to write in the examination. And the reduction of the gastric acid secretion. This is the number of drugs. This is also very, very important slide. This is very important chapter. This classification you have to write in the examination. First one, reduction of the gastric acid secretion. They reduces the gastric acid secretion. Second one, they neutralize. They never reduce. Second one, they neutralize the acid secretion. See, very wonderful. Just like antacids. And third one is ulcer protectives. It protects the mucus layer. Third one. Fourth one, H. pylori killers. H. pylori killers. Okay, like that. 4 types classified in the as per the not my classification. It is a classification of the Tripathi book. Here H2 antihistamine. Okay, H2 antihistamine. So it works against the histamine, antihistamine, like cimetidine, cement. You can keep in your mind. Tididine is a common here. Tidine, 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 cimetidine, ranitidine, famotidine, ranitidine, run, famotidine, famous, roxatidine, okay, like that. And next, proton pump inhibitors, pumping, just like Rajol. Rajol is a famous village in the East Godavari district of Andhra Pradesh. This point you have to get Rajol, omeprazole, esomeprazole, lansoprazole, pantoprazole, rabeprazole, dexrabeprazole, like that. All these names, proton pump inhibitor. Rajol is having a big pump. It inhibits the pump, like that. You can remember. Anticholinergic drugs, because sympathetic system, parasympathetic system produces acidity. Here, anticholinergic drugs, sympathetic, parasympathetic blockers, pyrenzipine, number of times. Here itself, mechanism of action you can complete. Pyrenzipine, propantheline, oxyphenone, like prostaglandin analogues, like misoprostol. Next, this prostaglandin analog means it looks like prostaglandin. Here, see, prostaglandin is here. I have already told you in here. Prostaglandin. All these are protective. Misoprostol is a protective prostaglandin analog. Okay, like that you can remember. Neutralization of the gastric, like antacid. Systemic antacids means which enters into the blood circulation and again it comes to the stomach, and there it produces the antacid effect. Whereas the non-systemic antacid, there itself local. Non-systemic means locally it produces acid secretion. You are taking alkali, so it will be neutralized in the body, in the stomach itself. It will be neutralized immediately locally. Okay, this is number of times this was appeared. Ulcer protective, like a sutral fate. See here, fate. Okay. Bismuth, like a kismet. Kismet means luck. Bismuth substrate, CBS. Anti-H. pylori drugs, antibiotics, amoxicillin, clarity, because anti-pylori is one of the organism, microorganism. Okay. Metronidazole, it is a bacteria. Tinidazole, tetracycline, all these are the anti-H. pylori. Now we will see here with the diagrams only. We can, all the things you can be keep in your mind. If you start writing running matter, if you start reading it, it goes to kilometers together. Don't concentrate on the running matter. Wherever possible, you try to. Okay. So here, proton pump inhibitor. See here, proton pump. Why we are calling this is proton pump? It pumps the acid outside. Parietal cell, stomach cell produces the acid. Acid H will be pumped out. K will be pumped in. This proton pump will be inhibited by the proton pump inhibitors like a Razolu, everything. So what happened? H will not be secreted, K will not be absorbed. This proton pump will be killed by the proton pump inhibitors, all the Razolu. Here H2 histamine like cimetidine, ranitidine, all these blocks the histamine. So when it blocks, there is no generation of the CAMP. So there is no generation of the calcium. So this calcium never encourages the proton pump. So proton pump activity will be stopped completely. You got the point? The entire thing is there in the diagram. This diagram is equal to 4 to 5 pages matter. Okay. Key points. It has appeared in the GPAT question paper. Ranitidine. It is a non-imidazole class. A furon ring is there. Furon ring. 5 times more than the cimetidine. Number of times these bits were appeared. No anti-androgenic action. It does not increase the prolactin secretion. Famotidine. It has a thiazole ring. Thiazole. Longer duration of action. 5 to 8 times more potent than the ranitidine. See, ranitidine is potent than the cimetidine. They will ask in the examination order. Cimetidine, next ranitidine, next famotidine. 5 to 4 potent than. Absence of anti-androgenic action. All these points are appeared in the question paper. Yeah, this is also very important. Here, this is proton pump. Same diagram only. Same diagram only. Just a small modification. See, prostaglandin having a negative action on the CAMP. So there is no production of the acidity. Prostaglandins are very good. PC series. Okay. Somatostatin is also having a negative effect. See here. So those drugs which support to the somatostatin, those drugs that supports the prostaglandin are friendly. And here see cimetidine, it blocks the histaminic block. And proton pump inhibitor, razole, this is proton pump. It secretes the HCl. It will be stopped here. Diagrams you have to enjoy. Acetylcholine, parasympathetic system. It increases the acidity, parasympathetic system. Atropine blocks the acetylcholine. It blocking. This is parasympathetic blockers. Like G cells, gastrin. See this diagram. You see, you have to enjoy the reading. This is antacid. How the antacids will? See, whenever there was you are taking a sodium bicarbonate. This is antacid. This sodium bicarbonate, here H is released, acidity. This combines. So H2CO3, it again converted into H2O water. Neutralization, water formed, carbon dioxide will formed. See here, this is very, very important. Here, calcium carbonate, H binds with CO3, acid molecule. MgOH3, magnesium dioxide, H binds with OH here. Okay, if you are taking aluminum trioxide, H binds with OH. See, this is also very important note. Magnesium compounds has a laxative effect. Laxative. This is also a number of times appeared. Whereas aluminum causes a constipation. Aluminate causes that is another side effect. Constipation. This is a motion, laxative effect. Antacids combining. That's why we are using a aluminum as well as magnesium. So antacids containing both aluminum and magnesium. That is better to use because magnesium produces a motion. Aluminum doesn't. It stops the motion. So both are having a opposite action. That's why whenever you are taking an antacid, it must consist of both magnesium as well as aluminum and also carbon. That is a carbon that we know or hydroxide action. Sucralfate, Kismet. Okay, not Kismet, sucralfate. It protects the, see here, layer is formed. This is nothing but a sucralfate. So see, there was an ulcer here, breadth of the layer. Now protection, ulcer, this acid whichever is produced, it doesn't attack the ulcer because there was a production. See here, this is a sucralfate structure. Into this sucralfate hydrogen, whenever hydrogen is released here, it binds the negative like this. Here negative and also negative. Like conversion of this is sucralfate. Conversion in acidic environment, H environment. pH, whenever pH is less than 4, sucralfate will be combined. So all the chains will be combined. It forms a bigger chain, cross-linking and formation of a paste. That paste will be formed as a coating, sucralfate. Very, very important. Mechanofaction, very important. Okay. Sucralfate, it forms a chain, a polymeric chain, big chain. That chain, it go and stick to the wall of the stomach. That is ulcer. So ulcers will not be attacked by the HCl now, like that. And Kismet, like bismuth, Kismet, like mucus layer. Bismuth is having a 3 mechanofaction: formation of protective coating, induction of the mucosal protection factor, antimicrobial action H. pylori. Like that, bismuth is having a 3 action. Number of times it was appeared. See here, epithelium cell is there. It was ulcers was cleaned. Ulcers was cleaned because 3 actions are there. 3 in 1 bumper offer. Bismuth. That point you had treatment. Bismuth antimicrobial against the H. pylori. Induction of the mucosal protection factor like a prostaglandin series, PGA and HCO3. Very friendly. Formation of protective coating again on the mucus on the ulcer. Okay, yeah. Now come to the last slide. That is a H. pylori. This H. pylori is an organism, bacteria. It causes acute gastritis. Nowadays it is a common in the water. Regular general water leads to acidity. Okay, nowadays this is common. That's why all the doctors are writing that continuously. They are writing these drugs. H. pylori is a common acute gastritis. It leads to chronic gastritis. So duodenal ulcers, asymptomatic chronic gastritis, gastric ulcers, gastric cancer, it leads to. That's why you have to kill the H. pylori. That means that amoxicillin, all the antibiotics what I have shown in the class, that you have to take it so that it kills the H. pylori. So there is a blockage of the all the things. Okay, right. So I will end my session here. Download the app immediately and enjoy the reading.